All right, hi guys and girls, Matt here from Grab the Go Bag. I did promise you some videos as part of the NREMT prep course that I created on Google Classroom. So this is the first of those videos. We're going to look at some basic things about the certification exam here. Specifically now we're talking about the cognitive exam, the knowledge-based exam, not the skills exam. We will make a separate set of videos for the skills exam at a future time. Not right now. Okay, so here's what we're going to do. We're going to go to this website, nremt.org. That's the National Registry website. We're going to scroll down a little bit. You're going to see 4 different levels of certification, which you should be familiar with, especially if you are done with your initial EMT course. All right, now we're going to focus on EMT. We'll make videos in the future and prep content for paramedic level students or AEMT students, but right now we're going to focus on EMT. So I'm going to hit National EMT Certification. That's going to take me to specific info for that EMT level exam. All right, as I scroll down here, you're going to see we see certification process tab in white. That's just general knowledge information about the process. You have to do an initial EMT course within the 2 years prior to applying for National Registry certification. If you took your initial course farther back than that, it's not going to count for that application process. You also have to have your basic life support professional CPR card. And eventually you're going to have to pass a skills exam as well as a cognitive exam. Now we're focusing on the cognitive exam in this video series, so I'm going to hit cognitive exam and we're going to see a little bit more information here. So it tells us that this is an adaptive test. We're going to explain that in the next video. You're going to get somewhere between 70 to 120 questions, and 10 of those are going to be questions that don't count toward your score. All right, those are called pilot questions. It means they're testing those questions out for future tests to see if they want to use those as live questions. So out of your 70 to 120, you're going to have 60 to 110 actual graded questions that count for you. All right, you have 2 minutes to take this, sorry, not 2 minutes, 2 hours to take this exam. For a lot of candidates, that's more than enough time, but it is a pretty good pace. You don't have forever to really kind of waffle back and forth on different answers. You kind of have to know what you're doing and just get to answering the question and move on. All right. Now, there's 5 big categories here that I want to talk about, and you'll see that there's a slightly different percentage of the exam. How many questions, in other words, are going to be on that exam out of the total number of questions, and that kind of hovers around 20% for the first 3 categories. Okay, and they're pretty even. And then you've got medical, OB, GYN, and that category is a little bigger. Because medical is a huge category that covers a lot of stuff, all right? And then you've got one that's a little bit smaller. It's EMS operations. That's closer to 10%. So altogether, it's going to add up to 100%. And you can expect about 20% of airway, cardiology, and trauma, and then maybe about 30% medical and about 10% EMS operations. And that's going to give us a total of 100%. Now, within those categories that are focused on patients and patient care, you're going to find that 85% of those questions are based on adults and 15% based on pediatric. And then, of course, EMS operations, because those aren't patient care focused, those are operations focused, they don't have an age component to them. Okay. Now, we're not going to talk about retest right now because we're not worried about that. We're going to pass this attempt after we take EMT prep, NREMT prep, which we're doing right now. We're going to pass that attempt. So we're not going to worry yet about any retesting information or anything like that. What I do want to talk about is the old school exam or the linear exam versus the adaptive exam. And so now I'm just going to use the Google Classroom EMT course as an example. I'm going to scroll up here. And so here, Chapter 1, Intro to EMS, there's a quiz there. And I have an online quiz, but we're going to look at the PDF quiz because it's a little bit easier to see what I'm talking about. So the old way of taking exams, which I'm sure you're familiar with, is taking a standard exam or what's called a linear exam. So look at these 9 multiple choice questions here. And you're going to see out of those 9 multiple choice questions, every sheet I hand out to a student here, they all get the same questions. Now they get them in the same order. So it's really easy for people sitting right next to each other to kind of look at each other's papers and kind of cheat. But we could do this a little differently. We could do this on a computer, all right? and the computer would make it possible to scramble the order of the questions and maybe even scramble the order of the answers. And so that makes cheating, as far as looking over somebody's shoulder, a lot more difficult. We're not going to worry about that in NREMT setting because they're not going to allow cheating. It's a very supervised test facility. They're going to have you videotaped. They're going to have you in a cubicle all by yourself. Please don't even think about cheating because you will get caught. So we're not going to worry about cheating so much, but I want you to see that essentially this test is the same for everyone who takes it. And this is a linear exam. So they're going to start with question 1, whatever that is, whether it's randomized or not. I only have 9 multiple choice questions here. So every student would get the same 9 multiple choice questions. All right. Now, that's what you're probably used to. You've probably taken a lot of tests and quizzes and exams just like that. But National Registry is not like that at all. And that's what we're going to talk about in the next video. This is one of the tests that's built on an adaptive process. It's an adaptive test. And that means something, a couple of very specific things. And that's going to make this test feel very strange compared to pretty much any other test you've probably taken up to this point. All right. So this is a linear test. This is the old way of doing things. This particular type of test would be paper and pencil. I could put this on a computer and I could still feed you 9 multiple choice questions. Everybody gets the same 9 questions, maybe in different order. That would still be a linear or standard test. It would just be called a computer-based test. Okay. Now, the National Registry test that you're going to take as an EMT candidate is going to be something called computer adaptive, and that's what makes it completely different. We're going to talk about that in the next video. For now, just understand we're not going to be doing this standard test format. It's going to feel a little bit different, and we're really going to be able to test those 5 categories: airway, cardiology, trauma, medical, as well as OBGYN, and then finally EMS operations. You're going to have to score some minimum requirements on each of those categories in order to complete the written part of the certification process. That's it for the first video. We'll see you in the next one, and we'll explain a lot more about that adaptive process.